My name is Zalalam Bakala. I am from Ethiopia, 58 years old. I come to Apollo to myeloma treatment. My back pain started back in 2023, where doctors were treating me for some sort of physiotherapy exercises, but it couldn't get improved. So I went to major hospitals in Ethiopia, and they said, there is coming some bone fracture, which is getting worse and worse. So in the meantime, they gave me some treatment, but it improved. But after that, it come back also again. At the start of January 2024, I just get crippled. So doctors said, you need to have a very intensive, diagnosis and treatment. So by that time, I met Dr. Alok Ranjan from Apollo Hospital in Addis Ababa. He suggested to have PET scan and some diagnosis for most probably myeloma, and he suggested to have it very quickly. And at the same time, also my doctors in Addis Ababa, they suggested also you need to rush to the hospital. So I came into Apollo August 2024 for back surgery, where I did have this vertoplasty for my lower back, where I was admitted here for about 1 month. At the same time, I was also being diagnosed for myeloma, and I was also treated for myeloma. I was having chemotherapy, and then I went back home. So I was also taking some chemotherapy drugs for this myeloma. And by January 2025, I came back to Apollo again for bone marrow transplant, where I stayed here for about 2 months this year for bone marrow transplant treatment. My bone marrow transplant treatment was head followed by Dr. Padmaja Lokireddy, consultant for this bone marrow transplant in Apollo, Hyderabad. And we did have a very good time, following up this treatment. After 2 months of treatment, I went back home with a very good treatment back home with our doctors and also follow-up of Dr. Padmaja Lokireddy. I'm now coming back to Apollo here for follow-up. The date before yesterday, we did have some tests, and the results are very good and encouraging. And now I am just switching my medicines to tablet one, which is a very good news for me. And it was also very good news for my family. Regarding the treatment that I did have with Apollo here, I'm very proud of the Apollo team. I start with the first doctor who was doing this, Dr. Alok. He did a very successful back surgery. After that, Dr. Padmaja did a very fantastic also work for me to have a very successful bone marrow transplant. All in all, the other crew also with Dr. Padmaja, the nurses, the doctors, all others were very cooperative. They were very family, they were friendly, and we did have a very good time here last time. And it was a very successful treatment in terms of communication, in terms of patient to doctors, patient to nurses communication. At the same time, the information flow was very good, and it gives hope for everybody to have a very smooth type of bone marrow transplant. And I can say that this is a success not only for me but also for Apollo staff to have such very coordinated services, medical services. So I thank you everybody, the nurses that was with me, especially mom, we call mom, Dr. Padmaja Lokireddy and Dr. Alok, to take me now to this journey. And I also thank other management members of Apollo for this one to happen. Thank you.
Hi, I'm Dr. Padmaja Lokireddy. I'm a Haematologist and transplant consultant at Apollo Hospital, Jubilee Hills, Hyderabad in India. It's my pleasure to talk about Mr. Beckley and my beloved patient. It's been a year and 5 months since his initial diagnosis and treatment. He is from Ethiopia and he started having back pain. And that's the time one of our neurosurgeons went to Ethiopia for consultations, and he saw him and he suspected multiple myeloma, and he brought him here. He had a multiple vertebral fractures which are fixed, and we did special tests, confirmed myeloma. He started on chemotherapy for 4 cycles with a VRD. Following that, he had a bone marrow transplant. He returned back to Ethiopia and he has come after a year. Unfortunately, we found that there is a residual disease left behind. So we suspected that his disease will come back too early. So we went on the maintenance strategies much earlier, and he's doing well. The beauty of this, what I wanted to highlight here is, patients cannot come here and stay from a different country for years and years here. So what we delivered for Mr. Beckley is to have the first after the spinal fixation, he had his first chemotherapy here. The remaining chemotherapies under our guidance were given in Ethiopia, and he came here for transplant. And again, the maintenance treatments, we have given all the protocols and everything which could be delivered in his own home country. And he has come here for checkup. He has communicated with us that he is coming back, so we could keep everything ready. So it's been a week. He has done all the investigations, treatment charts are all streamlined. He is going back next week. And I want to highlight, if you're a patient who is coming from abroad, this is something perhaps you should look into, whether your care can be delivered, an important care here in a tertiary care hospital, and some of the care can be delivered by your own physician in your own country. So I think that's a very important thing. It gives you time to stay with your own family, and the cost can be cut down because of this. And we still get the world-class treatment, and we still, part of your treatment, we will continue to be with your journey. We would love to have Mr. Beckley back in this year. I would love to see him probably once a year for a few years, and then continue his monitoring over back home. Thank you.
Thank you also,
Thank
Dr. Padmaja. It was a very successful, treatment in Apollo Hospital here, especially you, your crew, doctors, all these nurses around, who were very supportive of me and, take me back to this journey. And now I am standing here from the bottom now up, standing here, talking to
Thank
everybody.
you. Thank you. Lovely, lovely.